Senator Fazio.
Thank you, Madam President, for the indulgence. I also wanted to rise in support of the bill and compliment Senator Maroney, Senator Ciccarella, members of the General Law Committee, and members of the Public Health Committee on their collaborative efforts on this bill. This will doubtlessly improve access to drugs and health care in our state. One of the sections takes language from Senator Summers and my bill, Senate Bill 171, which came out of the Public Health Committee, and allows pharmacists who are trained and have a reciprocal agreement with a patient's doctor to prescribe oral contraceptives, birth control. It was implemented in over 20 other states around the country and has been met with success in all sorts of states around the country. It will give women more options, more access, it'll reduce costs, and it'll improve health outcomes. So and then it fits nicely into this bill because the similar concepts are being applied to other areas of medicine and it'll improve access across the board. We need to make sure that with a shortage in many cases of medical practitioners, that we're fully utilizing skilled professionals who are trained to do as much as possible to render healthcare. In the case of the birth control section, we've heard from women, from patients across the state since Senator Summers and I introduced the legislation that this was desired, that for many women, they saw that when they were younger that they could have utilized this option to use a pharmacist to get a birth control prescription. Others saying that they do social work in communities with fewer resources, with less access to physicians, and that this option is beneficial to them for that reason, that they could see access among the people they work with improve, that it would be better for them if they didn't have to pay sometimes hundreds and hundreds of dollars out of pocket to go to the physician to get the prescription, that they could go to one of their trained pharmacists. These pharmacists, as we said, probably have the training no matter what to do this, but with this added layer of protection that's written into the law, they will have even more training that will also require them to do health screenings with women when they're rendering, prescribing, and ultimately dispensing the drugs as well. So I think this is a positive development. I think this is going to improve access in our state. I actually like that it's 171 is being added to 6768 because I think it really works nicely in concert with all those other all these other great initiatives. And I appreciate that Senator Maroney and Senator Ciccarella and senators and representatives across the aisle worked hard in order to make this type of bipartisan legislation possible. So I certainly urge adoption. Thank you, Madam President.
Thank you, Senator Fazio. Will you